Hi, my name is Tia Matafari Hackett, and I'm going to talk to you today about psychotherapy and trauma. So as somebody who's been doing therapy for a number of decades, one of the reasons I really love gentle reprocessing is because when I'm talking to clients about trauma, one of the things I really want to make sure I'm not doing is re-traumatizing them. So as you'll see on the screen, one of the things that we talk about a lot is how to keep clients in their comfort zone, what we call the comfort zone or the sweet spot. So in the middle, what you'll see is this is where somebody feels really safe. This is where somebody feels really grounded and comfortable. This is where their emotion and their wise mind, their emotion and logic are working really well together. And often when somebody has gone through trauma, that sweet spot and that comfort zone is actually really small. Most of the time when somebody's gone through a lot of trauma, they're spending a lot of time either hyper-aroused, which you'll see at the top, or hypo-aroused, which you'll see down below. So if you're somebody who's feeling hyper-aroused a lot of the times, where you see at the top of the screen, you might be feeling fight or flight, you might be feeling anxious, hyper-vigilant, you might feel like you're angry a lot of the times, you might feel like you have a very short fuse that you're lashing out, you might have a lot of intrusive thoughts. You might feel like you're getting flooded with emotion and just feeling overwhelmed a lot of the times. You might even find yourself being very over-controlled, like you're trying to control your environment and things around you. If you're hypo-aroused, you might feel yourself being really low. You might feel yourself feeling very depressed or very sad, shutting down, kind of wanting to cocoon. It's like those days you want to go in bed and just pull the covers over your head. You might be filled with shame and despair. You might feel self-loathing. You might feel like, I just want this all to end. And just really feel like you want to avoid everything. So a lot of times, like I said, when you go through trauma, our comfort zone is really, really small. The goal of gentle reprocessing is to, number one, make sure that when we're treating you inside that comfort zone. Even though we're going to be dealing with your trauma, we're not going to bring you into that hyper-aroused or hypo-aroused place. We're going to actually be treating you and making sure we're keeping you in that comfort zone. And number two, the other goal of gentle reprocessing that's fantastic and empowering is that our goal is actually to increase the size of that comfort zone for you so that you actually feel like you have more range, and it takes you a lot longer before you start feeling hyper-aroused or hypo-aroused. And that's one of the many reasons I love doing gentle reprocessing.